that brings up kind of the next point, us, right? Is who's us? And I think that's going to vary based on size of your event, right? Whereas something as large as the fair that we're using kind of as an example here today deserves a multidiscipline team of doctors, nurses, medics, EMTs, the whole gamut. Might not necessarily be necessary for your 4th of July parade or your fireworks or something like that. But I think if I'll make a broad brushstroke here. I think if you have an event going on and you can involve your local hospitals to some extent, they may be willing, right? I don't want to speak for every hospital system in the world, obviously, but and I know we are on the far pendulum swing of that, where we're going out to as many of these things as we can, because that's just part of our UH program and our commitment to the community. But even at that, I mean, a small local hospital may be able to give you some assets or something like that. Get a few people to volunteer, or bolster that even just for a short time. It doesn't hurt to ask.
They're probably going to use it as a recruiting opportunity. Oh, hey,
potentially.
Hey, you're a nurse. You want to come work at our hospital? Like, we'd love to have you. This is some of the fun stuff we get to do.
They want to be seen out in the community as well, right? So don't just immediately think that it's completely on your shoulder, on your shoulders. Yeah,
you don't have to do it on your own. I think that's a great point. If you're going to have some type of event, parade, festival, street fair, large fair, whatever's going on in your community, touch base with your EMS coordinator or the hospital system that has your protocol, and then have that conversation. Do you have generalized numbers for how many people are going to attend every day? You need to check the weather. There's a lot of prep work that goes into it, but you never know. You might get some free help out of it, for a lack of a better word, that gives you a different viewpoint on it. And I think what we have learned over the years in doing our event medicine is it's better to be over-prepared, obviously, than under-prepared, because then now you can control a lot of that event. So if you have that mass casualty event or that massive heat emergency or cold emergency, you can control patients going to the hospital. You can control, maybe you only have so many ambulances, or you only have one exit point for those ambulances. You control a lot of that. You can bring a lot of calm to the chaos with that prior planning. So I think that's huge, is reaching out, and you might get resources from the Red Cross, the hospital, from all these different entities that might be able to come help, and maybe they only come during your peak time,
peak hours or something.
Like to Laura's point, I agree 100%, is it depends on what's going on at the fair is where your massive crowd's going to move. So Brantley Gilbert's coming this year, so that crowd is going to shift. They're all going to be in the grandstands.
And what time they're going to start lining up to get in, and who has VIP and 100%. All of that.
So it's pretty easy to judge it by their schedule. To your point, it's a great point. I know, the rest of the fair is not going to be as busy. Yeah, there's going to be people that want to go get a gyro or a pizza like me, but, for the most part,
I can pull my resources from my second station to my main station where everyone's at.
Yeah, so you got to have some mobile assets. That's why trailers work really well. Yep. I mean, large fairgrounds have fixed structures, which are extremely beneficial. But I think the more people you get engaged in your event, have some pre-planned meetings that can help.
Absolutely. And just as a courtesy, let's take the, hey, can you give us assets and help and stuff, logistical support, in a conversation with the hospital? They should know that there's a potential for an influx of patients, right? That same event I was recalling, where the Gator was having access problems, and we just pivoted to humans walking. I personally wound up taking a patient to the hospital when I called in. Hey, I'm bringing them from this event, and they're like, "What's that?" You're the closest hospital, and you know nothing about this. This was not This was not well designed by the planners of that event, right? They had no idea that and we, in that particular case, we didn't inundate them. We brought them several, but it wasn't inundation. But they still, till we started showing up. That's not the time for staffing. You can't make any staffing decisions. You can't make any. They can't make any decisions up. How many beds are available or what. Any control they might have. at that point it's gone, right? And they can't help your cause at that point, right? And then you're going to be mad because, oh, we had a long turnaround time at the hospital, right?
Yeah, but they didn't know about the event at all.
But they didn't know.
Yeah.
Yeah.
That's a good point too. Yeah.
Yeah.
Involving more partners is just, it's going to give you more resources. Talk to the EMA, talk to Red Cross, talk to the hospital, and then that allows them to plan on their end.
Yeah.
So and that relates back to, that's why I think we talk a lot about EMS and fire departments, because they're so engaged in the community. I know we keep using Canfield as an example, but they're a good example. I mean, how far ahead do all the meetings start?
They've already started.
With all the people. So like months and months ahead of time, so that you keep reviewing all of these steps. So it's, oh, we forgot to tell this person, or let's engage them. You have months to engage them in that. It's not like you don't know the fair's coming. You don't know these large events are coming. So yeah, and you got to let the hospital know. Instead of, like, to your point, well, especially as resources in fire and EMS are so limited right now, if you do not tell that hospital and now your turnaround times are increased and you need a good
Now you
flow.
got gaps in coverage.
I kind of use Geaugas Fair as an example. You have staffing for the fair and you have staffing for event medicine, and you know how many ambulances you have to essentially make that loop back and forth between the event medicine or your field hospital and the hospital that you're transporting them to. So you kind of placate on, okay, I got one that just dropped off, they're coming back, I'm going to start the second one, my another ambulance is coming back. It's a logistics game is what it boils down to, is how can I move these people safely and treat them in a controlled environment, but also not deplete myself of all of those resources. Are they going to get stuck in traffic? Do I have enough ambulances? All those types of things. So I think it's a huge point to involve facilities.
There's two other points that kind of dovetail with that, and again, I'll use the marathon experience. At the beginning of the day, the Cleveland Medical Center is where most of our patients from the Cleveland Marathon wind up. Along the route, there's other hospitals, right? We make it a point to call all those hospitals, like, hey, just a reminder, Cleveland Marathon's going on today. Things might be coming in. Yeah. Then we talk to our people at UH, where the vast majority of patients are going to go, and we have a EMS traffic handler there. We affectionately call them quarterbacks. And so we'll call the EMS quarterback and say, I need priority beds today for this time to this time, right? I don't care what the bed is. It can just be bring 4 extra hall beds down, whatever you need to do, but we need quick turns. And then the other thing is briefing the crews. This isn't a regular, especially in that where nothing happens, everything happens. Yep. You go from, everybody sitting around bored, half asleep, to everybody's running, system status 0, I got 4, or -4, I've got 4 calls waiting, right? All over the course, because the half marathon's ending and everybody's coming back and collapsing. There's very predictable things that happen in that, having done it for so long. But the other thing is coaching the crews. Guys, these are short turnarounds, right? This isn't go into the EMS room and get cookies and a water and talk to your friends, flirt with the nurses, whatever you're going to do, right? Today's not the day, right? Your report is going to be, you're going to be doing the report on the way back, right? Make these short turnaround times, because especially in those high volume events, not a tremendous amount, but there's just, it all happens at the same time. If we spread that out over the entire event, it would be a very manageable thing. It never happens that way, right? And I mean, that's pretty much true of, I would imagine, of anything, right? There's always those peak hours. If it's your first time doing, you don't know, then, I mean, you could probably guess and estimate, but you're never going to know until real time.
No.
Another thing another resource to reach out to is the paramedic programs, right? They're doing clinical time, they're doing rotation time, and having them there as extra resources, extra hands. They need that IV stick, they need all of these different skills. They're going to see everything at some of these really big events, and even the smaller events. If you're concerned, like a fair route, they can be people that you can stage throughout to at least start and get things going. I know at the Canfield Fair, we've had them the last, I think, 2 years, and they've been very helpful on the really busy days, just with patient control and who gets a bed, who gets treated at the door, that kind of stuff.
Absolutely. There was a big paramedic student cash at the marathon recently at the start finish line, and they were same thing. They were doing all this.
But it's not a good experience.
Absolutely,
it's real, true street medicine type stuff.
No, it was, it's in there. It's mandated as part of their curriculum as mass casualty experience and training. And
you want to teach triage? That's the way to teach it.
That's it.
That's it, right,
You're doing it.
And that's an excellent way to do it. Yeah, that's a great point. For that and involving the paramedic programs, get them out, get them that firsthand experience, and then what do we want? We want to give our students the most high fidelity experience and training that you could possibly get. Well,
real people's is it.
Well, and they're working
real people and experience is it.
Right, and they're working in an environment where they're with, UH nurses, UH paramedics, UH physicians who are their medical control. They're working with, the UH boxes, and they're seeing all of the stuff that they are probably going to see in this area in 6 months, and they're going to be the medic.
Yeah, it just better prepares them. I agree.
The part of that preparation is expecting the worst of, some sort of mass casualty, tornado hits, active shooter, whatever nonsense the world's going to throw at you. And a lot of that now ties in with pre-planning with your local police, fire, so like some of the events UH that we do, like the Cleveland Browns, we go so far as to have at the ready tactical medics if there is an event who are going to provide, they're going to go forward and do the care under fire, if you will, while everybody else shelters in place. So that it expands well beyond just, well, I'm here to hand out aspirin and Band-Aids and going back to our tactical medicine podcast episode, right? I mean, what was the big takeaway from that? It can happen here.
Yep, it can happen anywhere.
You are incredibly short-sighted if you don't think that it could happen here, wherever here is. I mean,
doesn't matter what it is.
It doesn't. Yeah, I mean,
it could be a street fair. It could be a high school graduation with a gym full of people, or all the bleachers are full, or a concert, a fair. It could be all of those types of things. All you need is a large amount of people, and then one individual that wants to do harm. Yeah. Wants to do harm, unfortunately.
Yeah.
And
it doesn't even have to be a bad actor. It could just be an accident. Imagine if we have a food truck there that's frying food, and then they have a leak, and you have a big explosion.
Yeah, right.
So you've got propane in the area, you've got hot grease in the area, and you got everyone waiting for their basket of fries.
Yeah.
And that thing goes up. You now have a number of
victims.
A bomb. Yeah,
there's a bomb. You have a bomb. You have an unintentional bombing. But it's exactly it. It doesn't have to necessarily be malicious.
Correct.
But it'd be responded to the exact same way.
Yep.
So all of your triage, your mass cal stuff,
TAC med stuff.
Yeah. If you're blessed to have such resources available.
But it's also planning and knowing who has kits and who has Narcan and who has Stop the Bleed stuff and where is it located in the different buildings.
People don't overdose at the at the fair.
Come to Canfield.
But what do the cops have on them? As running our little hospital that we run there, I like to know how many officers do we have and what do they have on them?
What do they have on them?
Right, and where are they stationed and where is our emergency exit vehicle stationed?
Do you guys have tourniquets? Nope. Here's a tourniquet.
Here's a tourniquet. You may return it in 6 days.
That's not the UH way. Here's a tourniquet.
Keep it.
Put that in your pocket.
Please never use it.
Yes. Yeah. Please never need to use this.
Yes.
But here's 2 for good measure.
Yeah.
Well, I mean, I guess to that point, I had an event that I was a part of in Youngstown where we literally just made up Narcan boxes. So that way every provider there could have Narcan on them.
Yeah.
And then after the event, we just flipped it out to the pharmacy to just have extra Narcan at an event.
That is, you're spot on there. We, at my former place, we did medicine at a coliseum, basically, right? And a high-profile rapper came in, and said crowd came with high-profile rapper, and we did exactly that. We called down to the pharmacy, and we just ordered up bricks of Narcan.
Yep.
And we just
I'll return what I don't need.
And that's exactly what happened, right? Is we probably had, 60, 70 doses of it, just brick after brick after brick. We used a fair amount, that particular one. The one that actually, let me tell you where I got burned, in planning for it was a rave, and we
You were
took
attending or working? I'm sorry. For clarification.
You sound like the old
Something
of
rave.
I was putting it on.
All right.
I was at my house.
Make it sense.
But we had, we'll get all of this, and we sent all of this Narcan, not quite as much as that other event I was talking about, but we sent additional Narcan, extra drug box, a couple extra mini kits that had Narcan in it. And a bunch of bad PCP went around at that. And we needed more ketamine. So that was like a 2 or 3 day thing.
Wow.
It was some mega event, had several happenings. I wind up needing to go into work and take extra drug boxes down and restock things just for ketamine because people were going nuts on the PCP.
Wow.
So it's short-sighted on our behalf, and hopefully maybe lesson learned to
part of planning.
Know your audience, right? We were like,
Well, I think that talks about all supplies, right? What if something unplanned for happens?
Absolutely.
How am I going to get more supplies? Like, make sure that I have enough of what I think I'm going to need, and how do I get extras in a very short amount of time? If I have a 3-day affair, 3-day thing going on, Friday, Saturday, Sunday,
Right.
and I burn through all my stock on Friday, and now it's a weekend, how do I get more of the said supply that I'm going to need for the next 2 days?
Yeah.
Ketamine.
In that particular case, because that was the one that burned me.
Yeah.
We had prepared for what we thought was going to be a bunch of heroin and the usual stuff. Nope, and lesson learned.
But I could think of, let's say that you had a bunch of cardiac arrests that happened. You burned through all your pads for your
Perfect, yeah. All
Like
your
how can I make sure that I got enough epinephrine?
We ran into a bunch of diabetics, and we went through liters and liters of fluid, of IV fluid. And, now this year I'm like, I need extra cases.
Cases, right?
Like I need cases of that to come, not just a couple
I had
bags.
one of those.
Yeah.
Because they didn't want to go to the hospital.
Right.
And then we're trying.
They want to go back to the fair.
They want to go back to the fair. I want to
go back to the fair.
I want to go eat more food.
More carbohydrates.
And I'm going to come back.
You're going to get my sugar moderately under control.
Oh, you're under 300. I haven't been there in years. I'm good.
Cinnamon roll time.
That's right. The other thing that I certainly have run into is depending on who's sponsoring it and who will be in attendance, not only does, like local credentialing, like who we're going to let into these areas, police, fire, law enforcement. When you start talking about larger things where now you get like FBI, Secret Service, stuff like that, I will tell you that, some of our, going back to my experience with the RNC, the night before they were changing the rules for access and credentialing, and they were like, now we need everybody's copy of everybody's birth certificate. And in that particular situation, we were talking about a staff of 200 people that we were trying to put, like, hey man, I need a copy of your birth. I don't even know where my birth certificate is. Gotta find it. You gotta find it or you can't work. I mean, it was really, so, that may be something as simple as, an agreement like, hey, these are the people we're going to let in, and you got somebody just traffic handling, or you'll have some formal body that is credentialing people and giving giving a formal blessing and maybe even a full-on background check. None of those things happen instantaneously, right?
Nope.
Again, those things need to start way ahead of time. In that particular situation, they're like, just send us the information of the people that you're going to have staffing the event. If stuff goes sideways, everybody's going, right?
Mm-hmm. Yeah.
So I'm like, this doesn't work. Everybody has to be credentialed. Everybody has to be authorized. What if you're going to just magically start letting people in if a bomb goes off or somebody starts shooting?
Mm-hmm.
No, you're still going to hold them all up at the You're going to hold them up at the at the warm zone, and as that particular event. You're not going to let them in, right? So
no, they have to be credentialed to meet all access areas for where they're going to be needed, and then that's something we do in our organization when we help with the air show. So we're entering a military installation.
Yep, perfect example. Yep.
Kind of secure. It's kind of secure there, I would say.
Little
the
bit.
gentleman holding an M4 at the front gate.
A little bit.
So you can't just get in. So weeks beforehand, if not,
Well, you probably get 5 or
months,
6 steps in, but
not very far. They have this really cool gate that comes out of the ground.
oh, really?
Yeah, it's pretty badass. Not gonna lie, flip a car right over. It's so totally cool. But like months ahead of time, we'll submit all of our employees.
Absolutely.
You always submit more than you need, because what happens when someone calls off sick? Well, now we need to replace them. So
Yep.
yeah, you always want to credential more people, and they have to do all of their military checks per DoD.
Yep.
And then you'll be issued a pass, and it's a pass for this time, these
This time,
windows.
this-
It's very
yep.
structured,
Yep.
and we have a great relationship with them. I love Chief Lewis out there, and they're excellent to work with. It's just there are formal parameters
There are, very
that
much
you have to follow. And then to your point, now you have to think into, if I have this emergency there, now I need to get more units onto that scene that are not credentialed, that have not been through that. So those could be some hang-ups, some bottlenecks for you. You got to think of those
that
things.
might, yeah, that might, part of that planning might be, if the big event happens, hey, all of us that are already in the hot zone or in the warm zone, we're just going to be bringing them out to the periphery
Yep.
of you, right? Everybody else stay outside, because
Yeah.
we can't get you in a timely manner to begin with. And I gave my example of of getting the people back into the RNC. They got to have the whole truck bomb sniffed and stuff. It would take an hour.
Yep.
And then escorted. Guess what? There's not going to be an escort if there's a big event, right? So now we're stuck. Nobody can get in or out. But
Yeah, sometimes it's hard to even move at the fair.
Sure.
It's
Yeah.
just, you have all these rows of food trucks, and you have the walking path, and it's all people half the time. Canfield's trying to get a golf cart through there, and that's damn near impossible half the
Yeah,
time.
sometimes,
just because
right?
there's a lot of people. So all the odds and ends you got to think about.
And as far as so we talked about supply logistics and needing to have that backup plan, like Dr. Hill was talking about. Where are we going to get the next thing if we use a bunch of it?
Laura does an excellent job
Yeah.
of that at the fair, and that's a huge point. Is this is what we have the field hospital stocked with, the other field hospital
Yep.
stocked with, and then we have a mobile unit that has overflow, and then even the logistics of weird things like, where are we going to get rid of all of our linen that you fill up the bags,
Well,
like
All your
that was-
sharps.
all your sharps containers. That was something we learned very quickly. I think our first year was, okay, we have just bags and bags and bags of linen, and by the end of the week the trailer was pretty full of linen.
Yeah.
Sure.
After 6 days and 500 and some patients, it's full.
Yeah, you use a lot of pillowcases, blankets,
Right.
and sheets, but it's all those types of things that you have to think about. I know it sounds goofy and silly, but Laura does an excellent job at that.
That was I was bringing that back up for those points to share some experience that that developed over time. Is we learned on these bigger events just to staff somebody as a runner. It's their job. We give them a vehicle.
Gopher.
We give them a vehicle, and your job is to hang out and get things, whatever that is. Access to money in case they have to go buy things,
Yeah.
right? Whether that's a corporate credit card or whatever the arrangement is, right? Whether that's run stuff to and from the hospital, get rid of linens, get rid of... and that was developed out of that 1 year that I was telling you about the marathon, where we hit every single... Because we actually we hit every single season, because we had to split a team up and send people, because we were all geared up for hyperthermia. We were not well equipped for hypothermia, which was occurring. And then, of course, we had hyperthermia later in the day. But we had to split teams to go get more linens and things to wrap people up in, and aluminized blankets and stuff like that. So I guess plan for the unknown and just have some flexibility built in there and some backup plan to get things that you hadn't thought of, right?
And I think a big part of it is, have that open communication with your storeroom or whoever your supplies person is, have their cell phone number and say, like, hey, we're running low on this. Can you get these ready? Especially like for us, it's a holiday weekend. And a lot of these events are holiday weekends, right? So your person, your contact may not always be there. So you need to say, like, I need to have this open communication for this time period, just so that if I need something, it can come.
I need to know who your staff is this weekend so I can...
I can communicate that and get what we need.
Or answer my phone call.
Whichever.
That's true.
Or a little of both.
Or the person I send there to show up, the gopher, I need you to give them the stuff because, maybe they've never met.
Well, especially like drug boxes. I mean,
Yeah,
usually
that's
at one
huge.
point during the fair, we have to go exchange drug boxes, and our closest hospital is UH Portage.
Yeah.
So, making sure that we have people with the right credentials to be able to go and do that, and someone at pharmacy is going to say, oh, yes, you're good to exchange these.
Right?
Right? You can't just send anybody.
But when we start bringing in that element of pharmaceuticals, now we're talking about storage, temperature management, whatever your state's rules or federal government's rules are on as far as the regulatory commitments to having pharmaceuticals, the selection, the storage, who's going to administer them. You talked about, who's going to transport them and replenish if need be. Something to keep in mind if, you're, and I'm working this from an Ohio perspective because obviously I'm familiar with Ohio law. But if you're going to have a vehicle there for more than 24 hours, you have to give the board written notice that you're going to have a vehicle with drugs on it for greater than 24 hours, right? And you have to tell them you're posting up for this event. You can't just willy-nilly do that. And then, the RNC, when we locked ambulances inside the hot zone, we had to do that ahead of time. Hey, pharmacy board, we're posting up is their legal terms that they use in Ohio. Hey, we're posting up. We got drugs secured in these vehicles down there, and they make you just write a dissertation on how you're going to store it, and how you're going to manage it, and all that. It's really not that big a deal, but again, it's one thing you don't want to be caught with your pants down if something goes sideways.
Sure.
And you come under any type of scrutiny.
Well, there's also the concern of, who can exchange the boxes, right? So, I cannot exchange drug boxes. I'm a nurse. I'm not allowed to exchange them. It has to be a paramedic because they're paramedic boxes. But you also have the concern of, we have Dr. Hill a couple days with us on site. I can give medications based on his order,
right.
but I've never been trained on the drug box. So if you're working with somebody who isn't familiar with maybe that drug box, like nurses at different events that you have,
that's true.
They're not familiar with that. The first time I saw one was at a fair.
That's not the time to be learning it.
Correct.
Right?
So it's just, something to think about too, is if you are new to some of this equipment, familiarizing yourself with it.
That brings up, that actually brings up a really good point is, if you're getting other medical volunteers,
right.
Let's say an organization like, again, I hate using the marathon, but every year I get to see it. They get nurses, doctors from podiatry, from all over, all
right.
these different, all these different places in the hospital come down with their specialty, but they're using equipment they've never seen before, right?
Right, and they're using all sorts of things, right? And they're not in a familiar setting. Most of us are used to being in a building, in a controlled environment, and this is not that.
That's not that, for sure.